All right, it is Facebook Live Friday, 4:45 on Friday, our favorite time of the week. So today what we're doing is, once again, my name is Dr. Theodore Steves. I always say that, forget to say that. Dr. Theodore Steves with Rockford Family Eye Care. Today what we're going to be doing is we're going to be talking about lens materials, lens enhancements, and I have my two wonderful main opticians. I have my main optician, Ben, and my office manager, Melanie, who's going to be talking about materials, enhancements, and everything that is going to help you see well through your glasses. So I'm going to turn to Melanie here. My first question has to do with the thickness of materials. Does that matter? I mean, does material thickness really matter?
Yes. So when you've got someone with a high prescription, you want to recommend a thinner, lighter weight material. So we've got a couple examples here of two different materials. They're both the same prescription, okay? So this material, it's Trivex. It's a little bit thicker, heavier material. And this one here, it's high index. See how that's a lot thinner comparing the two lenses? Sorry, my hands are always shaky. So that definitely, it makes an impact on the comfort of the frame a lot. And also aesthetically, it looks a little bit nicer if your lens is like bulging out of the frame.
So it's more comfortable, it's lighter, yes. It just looks more cosmetically
yes.
appealing. Okay, great. So that's Trivex and plastic, correct? Two different options.
Trivex and high index.
Trivex and high index,
yes.
Okay, very good. So what about regular plastic?
So regular plastic, it's about the same thickness as the Trivex lens, sometimes a little bit thicker, but otherwise, yeah.
Okay. What about glass? What about glass lenses?
Glass lenses are usually very heavy.
Yeah.
Okay. Some people love them, but normally we recommend something else a little bit lighter.
It tends to be a lot heavier. Yep. So when we do get the request for glass lenses, we can do them, but
yes.
it's just a little bit. We always try to educate on how heavy they're going to be, and if you have a high prescription, then they're definitely going to be heavy. Okay, so what about thicknesses of various sizes or prescription differences?
So prescription differences, you're going to have, if you've got a plus power, the thickest part of the lens is going to be in the center of the lens, and then it'll get thinner out towards the edges. And if you've got a minus power, it'll be thin in the middle and thicker at the edges. Is that what you were asking?
Yeah, basically, yeah.
Okay.
So if we have someone who has very far-sighted, they're a plus power, it'll be thicker in the center versus somebody who's nearsighted, it'll be thicker in the edges, okay? And that all kind of plays a role in when we pick out a pair of frames, because if someone is going to have a lot of thickness to the edge, you want to pick the right frame out.
Yeah, and we do have a little bit of an example of that. These two lenses are both the same prescription, and you can see just based on the size, this lens is obviously picked for a bigger frame, okay? So you've got the edges, those are a lot thicker than this lens, which is picked for a lot thinner frame.
But it's the exact same prescription.
Yep, exactly.
When you go with a larger frame, you're going to have a little more thickness there. So once again, depending on the prescription and the patient's wants, we try to get the right frame that's going to minimize that thickness. All right, so on to Ben here. Ben's going to talk a little bit about lens enhancements, whether that be anti-reflective coating, transitions, blue light filters, all that fun stuff.
So anti-reflective coating is exactly what it sounds like. It's going to reduce the reflections off the front of your lens. This lens has it. You can see, if you come in close, you can see some bright white spots, the reflections of the lights, but they're relatively small and hard to find. And if we go with one of our demo lenses, we don't have that. And it's just, the reflections are so much larger and more noticeable. It can be quite irritating.
So why would somebody, or what's a situation where somebody would ask for, or what's a good example of why you'd put somebody in the anti-reflective
I put
coating?
anti-reflective coating on just about every lens that I make, just because the clarity through an anti-reflective lens just blows away any possible negative effects. There's very few negative effects that I've ever seen, and it's the one thing that I can do to make your vision clearer without doing anything with the actual prescription. Most of the anti-reflective coatings that we work with now also incorporate blue light filter, so all that blue light that you've been hearing about coming off your phone or your tablet or anything like that, your computer screen, it reduces it by about a third, and it still keeps you getting the good blue light that helps regulate your circadian rhythms, your sleep and wake, and
Your
all that
sleeping
good
patterns
stuff.
and all that stuff, yeah.
So it's good there.
So yeah, anti-reflective coatings are great. And I always tell my patients I'm going to recommend it on everybody for multiple reasons. If you buy the cheapest disposable camera out there, it has an anti-reflective coating on it because they know that the optics through that is so much better. Every bit of testing equipment that we have has anti-reflective coating on it. So why wouldn't we suggest that when we know that's what's going to help the patient see the best? What about transitions, Ben?
Transitions is also a wonderful option. I've actually got a transition lens right here. Shine a UV light on it and you can watch it as it'll get dark. So when you're wearing this outside, it reacts to the UV light from the sun, gets nice and dark, and then when you come back inside, it slowly clears back up. It's pretty cool technology.
So transitions are great because they can help with, just ease of having, instead of having a second pair, that pair that they have is going to cover all their functions.
Absolutely.
And they've come a long ways in the last even
Absolutely
5-10 years as far as transitions go.
They get darker and change color faster. So.
All right, so that's always a benefit for people. So you get the health benefits, plus they get the clear vision when it's clear out. Okay, so Melanie here is going to do a demonstration on a couple of the lens materials that we have here. So when I'm doing an exam on a child, I'm always going to recommend a polycarbonate material because polycarbonate is more of an impact resistance lens. Now, doesn't mean that it can't break, but it's very, very hard to do it. And I want to kind of demonstrate on how hard it is versus plastic, which can shatter. Okay, so anybody who's really, really active or does certain safety protocols, they got to be in the right corrective, sort of protective lens. So Melanie is going to demonstrate what it is like to break a plastic, correct?
Yes.
A plastic
so
first,
this is a plastic lens that we've got here.
Obviously, she's going to put on some protective measures here.
Yep, and then I've got a hammer. Okay. Are you sure
That's surprising.
Are you sure that one's plastic?
Should be.
No, it's not.
No, this is poly.
That's poly. All right.
Yeah. Can
Number
we get
2.
a demo? Yeah. There's one in the lab.
All right, so that's the poly.
Yeah.
We thought it was plastic. So let's see here. Hit it a little bit harder, Melanie. I want to show them how if you have to hit it pretty hard. It's not going to break at all, okay?
See, that one hasn't been scratched. Okay. This one is plastic. Ooh.
So easily it cracks.
It actually shatters. So there's a bunch of pieces, and especially for a young child, you wouldn't want, that type of thing.